Today's conversation sits at the intersection of regulation, accountability, and professional growth. We're joined by Catrice, whose work with credits places her at the center of how dental boards across the country approach discipline, remediation, and ethics. Credit serves a unique role in the dental regulatory ecosystem. Rather than acting as a disciplinary authority itself, it supports dental boards by providing consistent, defensible remediation pathways, particularly in complex cases where education, ethics, and behavior change matter as much as enforcement. Catrice's work focuses on helping boards move beyond simply identifying violations toward addressing root causes and reducing the likelihood of recurrence. That means building remediation processes that are fair, structured, and focused on protecting the public while giving practitioners a clear path forward. Today, we'll explore how that work actually functions in practice, why ethics plays such a central role, where the system works well, and where the real challenges are when remediation meets the realities of regulation. Welcome, Catrice, to episode 1 of Board Insights. Really glad to have you.
Absolutely. Well, thank you for having us.
Why don't you give a quick synopsis of what Credits does, what your purpose is and your role, and how it's maybe grown since you've taken it on?
Absolutely. Well, as you mentioned, my name is Catrice Opichka, and I'm the director of our CARE programs. Just to kind of give you an idea of what CARE stands for, because I work for Credits, which historically is known as a dental and dental hygiene testing agency. About 3 years ago, we started down the path of creating a new branch or a new arm of the organization, which we lovingly call CARE. CARE stands for Calibrate, Assessment, Remediate, and Educate. So we started working with dental boards to help them have a resource for their remediation and re-education programs for licensees. So that's kind of how it all began. As far as the growth, I mean, it really is amazing to see how much we've been working with dental boards, the relationships we've been able to build. And I think, and we'll talk more about it, I'm sure, in a moment, but I think the key is really the customization that we provide. So we don't say, here's our remediation programs, take it or leave it. This is how it works. We really work with individual boards to create something that is custom for their needs. And I think that's kind of led to such quick growth and great relationship building with the boards. You had mentioned ethics. Obviously, that's our key component of our conversation today, but it's also a key component of what we do with the dental boards. And we build it into every remediation that we do. And again, I'm sure we'll talk more about that in a moment.
Yeah, that leads me into my first question. I appreciate that. Why does Credits view ethics as a foundational component of remediation rather than a case-by-case add-on?
So what we have found just in the last several years of building programs and working with licensees is that there is always an ethical component. Even when the cases that we are working with have a heavy clinical component where one would think, oh, this is a clinical issue, it oftentimes or almost all the time stems from an initial ethical issue. And the ethical issue, if I were to use a word that kind of sums up what we see, is shortcuts. Every case that is a clinical case has an ethical component that stems from probably initial decision-making that leads to shortcuts that leads to the clinical components. So everything we find has got at least a little bit of an ethical component. So we do build ethics into the core structure of what we do with licensees. And it's often one of the first things that we do with them before we even touch on the clinical component. We touch on, we do the assessments with EBAS to gauge where they are in their ethical decision making, because it helps guide us build those clinical components of our program.
Yeah, that's great. It leads me into my next question, and I'm sure that you'll touch on this, but how do you approach ethics remediation when a dentist may not initially believe that ethics is part of their issue, right? They may come to you and say that it's just a one-off or a mistake, or maybe it's a totally different issue outside of ethics. I'd assume that there's some reassurance you have to give them that yes, that ethics is going to be a part of this. Can you expound upon that a little bit further?
Absolutely. So I would say the majority of the licensees will not necessarily question. Early on, we would get some questions of why is this ethical component? I think it's just so the core of how we build our program, and it's posed as that. Uh, we usually will tell the licensee if they question the ethical component of our programming, that this is not them. We're not singling them out. We didn't look at their case and go, you need something's funny there. We do tell them that we build it into every single case because it is a core component of what we do. It gives us a baseline of where we need to go with the remediation. I would say recently, because we feel so strongly about it, and because we do reassure them that this isn't something that they are getting that somebody else isn't, that everybody gets this ethical piece, this ethical testing and education. I think they understand that they're not being singled out. This just is it's one piece of a pre-assessment that we do that helps guide their education.
Yeah, really helpful. How do you? My next question, I think, is in the sense of remediation, and how different tools are used. There's a number of different tools out there. How do you determine what's effective, what works, versus simply a check the box method that you maybe found has not worked, whether that's a CE credit or whether it's an educational webinar? What's your strategy and vision for ensuring that it resonates and that people actually take something from it when they return back to practice?
Oh, absolutely. And it kind of goes back to what I just mentioned about the pre assessment. What we do, instead of having, and I always call it like a boot camp situation, where, that's the easy route when it comes to remediation, is just put them into a number of courses, and you have this standardized coursework. Maybe they're joining other dentists or dental hygienists in that coursework, and it all looks the same. And I think what we do that is different is everything that we do, we use a pre-assessment to guide the education. So, in ethics, we look at EBAS as part of our pre-assessment. If our licensee aces that, we don't focus a lot of attention on ethics throughout. If they master some of the clinical coursework early on, they are, we use that pre-assessment to guide how much time we need for the licensees. So I think that's the component that makes it different and not so standardized and not just checking a box. It is us truly looking at where are their skills, where are their thoughts in the area of ethics, and then use that as a guide, again, to their education. So we don't believe in just checking a box. We really do believe in digging in deeper, seeing what the issues are, and then building the education. And then again, taking it to the final step of doing a post-assessment to ensure that there has been a change of behavior, a change of knowledge, a clinical understanding, moving forward. So we do really, our ultimate goal is to try to have these individuals kind of get back on the path that they started, whether it be clinically or ethically, to make those correct and safe decisions in their practice moving forward. Because as lovely as these individuals are, our goal is that we don't see them again, and
Yeah.
that they get back on track.
Yeah. Well, you teed up a question about EBOS, so I'm obviously going to ask a follow-up about that. What have you found with your use and implementation of EBOS compared to other remediation products? Like, why does it stand out to you? What benefits have you seen, not only from a client perspective, but I know that there's probably some insights you can share from a practitioner perspective of maybe some feedback they've shared.
So I love that. I love the psychometrics that are used in EBOS. I love the proof that in individuals has reached a standard. It's what boards are looking for, is So, we don't want to be whimsical in the way that we report back to the board. So EBAS gives us a tool that is easy to report back to the boards. So we use the essay exams again with every licensee because it gives us a defensible number or grade on something that is usually hard to define. And it allows us to do that because it does give such great psychometrics. It has that psychometrics behind it. And then we also use EBAS for the webinars, which are fantastic. And it usually, when we have reviews come back to us from our licensees, it's one of the things that they list as being most beneficial. And we like to use the webinars early on. So we don't require our licensees to take that education before they take the exam. They can do it in any order, but we do encourage them to think about scheduling it that way. Your webinars don't necessarily, you can't really teach ethics, but it does get them in an ethical mindset that kind of allows them to dig into those pieces of their understanding of ethics and how they would handle these scenarios or education. And we like to give them, we want for setting them up for success. So we want them to get into that ethical mindset before they go into that examination. We find that it really benefits them in that exam situation.
Yeah, really helpful. Thank you for sharing. What are the most common operational challenges that you in credits face when managing remediation? I would assume that there maybe could be some pushback or some challenges associated with boards asking, maybe, is this the right thing moving forward, or even on the licensee level? What do you usually face from a challenge perspective?
I don't even know if I would call them challenges, but we do, in working so custom with each board. I guess what would be looked at as a challenge is just making sure that we are following what the board wants us to do in the order that. So a lot of times our standard operating procedures aren't standard. They're custom operating procedures. So again, I don't really look at it as a challenge. It's more really getting to know the board, what they're looking for, and then building the relationship so we can help them write an appropriate board order or make sure that they're not missing pieces in that board order that can kind of help us along the way in creating the education for the licensee. Again, I don't know if it's as much of a challenge as it is an opportunity to really customize what we do for the board's needs. And every board has a different idea of how this looks. But we not only work with the leadership of the boards, but we work hand in hand with the board attorneys in ensuring that what is written is something that we are able to do for the licensee. So again, I think it's less about the challenges and more about it is 100% relationship building with the boards and helping them know what we are capable of and building that into the board order.
Yeah, it's really interesting. I think that you would agree. Please speak up if you don't. But I think with every remediation consent agreement you see, you probably maybe change or shift something because you learned something. What would you tell yourself when you started this role, I think just over 2.5 years ago, that you've learned along the way that maybe would be really important for somebody just stepping into the regulatory world or even somebody in the regulatory world? I think that it's a tight-knit community that's always looking to improve processes. Well, knowing what you know now, what would you tell yourself back then?
Oh my gosh. So many, I've learned so much along the way. My background is, I've been in dentistry for 30 years and much of that has been clinical and building education. And I think the thing that I've learned that has helped me the most along the way is understanding that it's important for us as the education organization, as the remediation organization, to be that link or buffer between the licensee and the board. You had mentioned it early on, licensees oftentimes come to us and they're not in the greatest space.
Yeah.
They're in the middle of probably the hardest thing they've ever had to deal with. And they don't always come to us as their best selves. And I think what we've learned along the way is there's some anger, there's a little animosity. Sometimes, they're not in a great place. And I didn't realize how much our role would be to be that communication buffer between the board and the licensee. That really helping the licensee understand why they're there, take accountability for why they're there. I mean, help guide them into, they, at the beginning, oftentimes licensees are not there yet. It takes us going through some of the education for them to understand, okay, this is not an ideal situation. The board is not the bad guy. And we try to help them see the board is not the bad guy. They're really looking out for public protection. That is our number one goal, is to help the board, achieve public protection and safe practice. And so I think early on, if I had known that we would be very much that buffer, that guide, that reassurance that they're going to be okay, and that the board is really looking out for the best interest of everybody, them, the public. I think that would have helped me along the way. And that's one of the biggest things I've learned is we are a remediation and re-education organization, but really we are counseling these individuals during the hardest time of their professional life.
Yeah, it's really insightful. I appreciate you sharing. I can imagine that a lot of dentists will come to you and have this a victim mentality, or a mentality where, they're just out to get me. And then they go through a process, and it may not be a fun first conversation with them. I'm sure it can be challenging. Can you share an example maybe of a story where you had talked to a dentist or a professional that came to you maybe angry and upset, and then just how they transitioned to almost just being thankful, or just what their thought was after remediation that credits handled?
I think we could probably use any example of like every licensee that we have seen is exactly what you just said. They start out a little bit prickly, and at the end they're appreciative, and we've seen that with every licensee. But the one that really stands out the most was it was actually a medical emergency in the dental practice case where the patient actually lost their life. It was a huge situation. It was the gravity of the situation. Everybody felt it when we started the remediation. And the individual definitely was angry, frustrated, didn't understand, it didn't seem like they were taking accountability early on, which is sometimes a surprise, especially in a case that is so severe. We worked with EBAS. We started with the ethical component, and then we went into, heavy duty education on medical emergencies. And I'll fast forward through the case, but there was such a huge shift with this individual toward the end. And we always end our education with a discussion with the licensee. We ask them, what is the biggest, what is the most impactful thing they learned? What was the biggest aha moment? And what are the things that they're specifically going to pull into practice that they've learned along the way? Because again, our goal is not to just check a box. We really want them to have a change of understanding, behavior, clinical skills. And in speaking with this dentist at the end, we realized that what appeared as the lack of accountability and frustration and anger at the beginning was really him emotionally dealing with the situation and going through the education. At the end, he stated that not only was it great education, he learned a lot. It was a lot of great reminders, but it was closure for him. And he used that word, and I thought it was really interesting that it was about the education. It was about getting back to a standard of care in his practice that he needed to kind of swing back into an acceptable standard of care in the area of medical emergencies. But it was also closure for him. He was dealing with so much inside. so much guilt and sadness, that that this person who he'd known for a long time had lost his life. That to get to the end and feel like he learned something, he was a completely different person, and it helped us realize, just because it seems like they're angry at the beginning, there's so many underlying things that they're going through emotionally.
Yeah.
And it was probably the biggest shift for somebody. And we were just really relieved and happy that we could be a part of that transformation, that education, and helping him understand that it's going to be okay. Yeah, and he can move on from this, and he can still practice, and be a safe practicing dentist.
Yeah, it's almost like credits and probably many, if not all, regulatory agencies out there act as a support system. And I think that's a big misperception is that a lot of them think that they're out to get them, right? That they're going to ruin their life. They're trying to revoke their license and take away everything that they've ever known. You said it earlier. I mean, these licensees are probably at one of the lowest points of their life. And so it's really interesting to hear you talk about that. I think my one, as we start to close out, one of my questions ringing in my mind is, as a licensee that may be seeing this and say, "Man, I'm just getting ready to start this process of remediation or possible going in front of a board." What would you tell them from a regulatory perspective, and maybe give them some encouragement that yes, they are there to support you and that they are looking out for the not only the betterment of you but also for the public as well. I mean, I think you've heard it every day. I hear it every day when I present, but all the boards are trying to protect the public. And I think it's a common line that people just throw around, but when you really start to believe it, which every board in my opinion does, I think that's really a critical tool. Can you just talk through that real quickly, or maybe give some just a heads up, I'll call it, to a licensee that may be just getting ready to go through this process?
Right. And I think you're absolutely right. I think it is really easy for somebody to think the board is out to get me.
Yeah.
The lawyer was out to get, like, there's always somebody. And then when there is an organization like Credits whose job is to ensure that they get back on track, or they regain these clinical skills, or this concept or knowledge or ethics, it's really easy to kind of fall into, it's just it's easy to blame other people. If it's easier, and rather than taking the accountability. I think if I had any advice for somebody who is just starting this process, is to understand exactly what you said, is the board really is there to protect the public. Credits and other agencies like ours in other fields, our goal is to help them get back on track. We see these individuals as wonderful people, wonderful dentists. Nobody wants to pull somebody's license.
Yeah.
It's the last thing the board wants to do. When I speak to boards, it often will come up, especially in a really severe, really big situation, a big case. They'll say, how can we help this individual? We don't want to pull their license. And I think that that's the biggest thing that I could say to somebody starting the process is, no one wants to take your license. We really want to help you kind of get back to safe practice. And our job is to not only help licensees do that and achieve that, but then prove to the boards, with defensible data, that they have actually reached, that
Yeah.
part is they've reached safe practicing dentist, and we're comfortable saying to the board that this is something that this individual has the ability to do, and repeat, and make a standard of practice.
Yeah. Great points. Based on what you and Credits have learned, what advice would you give another like-minded board, or maybe a board in another industry altogether? What advice would you give that board that's trying to modernize or strengthen their remediation approach?
Yep. I think, just historically, I've seen things change even with Credits and our relationship with the boards. And I think the thing I would say, to the boards is, we're here, organizations like Credits, we're here, to assist you. And so if there's something that is not feeling like it's working very well, just ask. If you ask for it, or you say, I love when a board comes to us and says, you know what I really would like? You know what would be really cool? Like, I love when they come to us with this dream of, "Oh, this is how I envision this relationship or working with licensees or an improved process. Oh man, if we could just do this." And their ability to share that with us and have us kind of go to the drawing board and go, can we do this? Can we make this work for you? And I think sometimes boards are we're used to the way it always used to be, and it was very rigid. And
Yeah.
I think they need to understand that they have to ask for it. If they think of something that works better, that we can do better, that they can do better, they have to say it, because customization can happen, and we can meet those needs. Again, we as credits, but we other agencies in different, in different fields, we have the ability to kind of come together, put our brains together, and come up with a better system or a better way to prove competency. I'm going to use one example. One of the things that we built in, I'm going to say within the last year, is professional monitoring. So not only do we have our remediation, but we have a new professional monitoring division. And what that does is oftentimes boards would not allow dentists to do a certain procedure for a year or after, until the remediation is done. And it's really debilitating for dentists to be told that you're not allowed to do this procedure, or you can't run your practice for another year. Professional monitoring is something that came about in speaking with boards, because they said, you know what we really need? And we were able to collaborate and do that. So now we have a way to actually work and track dentists and what they do in their practice, so they don't have to give up those procedures, or they don't have to shut down their practice for a year. So perfect example of just having that conversation and saying, boy, this would be helpful to the right people, and then be able to collaborate and make it happen.
Yeah, I think that it really hammers home the message. I think if you talk to people out there, the perception is that boards, to your point, have always been very rigid and stuck in their ways. And it's really exciting to look through a lens of what Credits is doing with the creativity and innovation aspect of it. It's two words you don't necessarily always hear in the regulatory world. So kudos to you and what Credits has done. I've really enjoyed the conversation today. It definitely has highlighted that effective remediation isn't just about addressing a violation. It's about strengthening professional judgment, reinforcing ethics, and ultimately protecting the public while giving practitioners a clear path forward. So thank you so much to you, Catrice, and Credits, and best wishes forward.
Absolutely. Thank you. And thank you for your wonderful work, collaboration, and helping us to provide a tool that we really do use every single day.
Yeah, we're excited to be a part of the solution. So thank you so much.
Awesome. Thank you.